So it'll be exactly the same for you as last time, just the other leg, so there'll be no surprises. Should be very straightforward for you.
Stuff.
Great, okay.
Thank you very much indeed.
Happy to go ahead. Let's pop you through next door to get changed.
Self on the side
I'll
of
go
the couch
through,
with your
yeah.
feet flat on the floor.
Like that.
That's it, usual thing. If we just tuck that up there if we could, that's great. So I'll press start there. So the back thing there, between is the vein. Okay, so I think that's fine. You've got to put needles in all of the marks.
No, no.
So this is where the superficial leak is.
He's on warfarin, so you'd expect to see a lot of bruising.
This is the tender bit of pain, isn't it?
Yeah. Yeah.
So here's the previously treated. So this is about 5 weeks ago, previously treated great saphenous vein, which you can see when I compress now is very solid. The deep veins in the leg, which are here, compress easily. That's the artery in the middle that doesn't squash. So there's no DVT there.
Your ulcers have healed up on this leg, have
Yeah,
they?
completely.
Mr. Bowden had his right leg treated about 5 weeks ago for ulcers that he'd had, what, for a couple of years?
Or at least.
At least, and
Yeah.
the ulcers have now gone, I
Yes.
think you were saying.
Yeah.
But to prevent the ulcers, as well as treating the veins, to reduce the risks of further ulcers in the future, we've fitted Mr. Bowden with this compression stocking, knee-length compression stocking, which he'll have to wear every day for the rest of his life to try and keep his legs in good condition and to keep the swelling down. So today we're going to go and treat the left leg, which isn't quite as bad as the right leg, but is still affected by ulcers and skin damage from his varicose veins.
There we go. So this is where the ulcer was.
But I have had ulcers all the way down there.
Mm.
And so you can see the discoloration of the skin anyway.
But this was the worst leg of the two,
Oh,
wasn't
yes.
it?
Oh, yes.
And this is, I think, dramatically improved
it
in
is.
just a few weeks.
It is.
So, and you can see that the stocking is controlling the swelling that you had.
Yep.
So, how do you find wearing the stockings? Is it okay?
No problem with the short ones.
Yes.
But as those long ones,
I
I
know.
just cannot keep them off at all.
Yeah.
They all rock
Well,
up
you
and
get
down
you
all
get pretty much all of the benefit from a knee-length stocking, so
Yeah.
we don't need to fit you with a
Quite.
full-length
No,
stocking.
well, as I say, I'm perfectly happy with the others.
Great. We'll have to put a full-length stocking on this
Oh, to
leg
start
today
with,
for the
yeah.
treatment, but
Yeah.
that only stays on for a short
No
period of
problem.
time, as you know, and then we'll fit you with a knee-length stocking back on this side again.
Lovely.
Okay, very good.
Pop this one back on.
The other thing that's important about these treatments is because we're putting tight bandages and compression on, we need to make sure that their arteries are okay. So we always make sure that we can feel the pulses in the patient's feet. And if we're not sure about the pulses, we'll scan the arteries as well and do some Doppler tests just to make sure the pressure in the arteries and in the feet is adequate for the compression to go on. So if I could get you to shuggle around onto your left hip towards me, so the inside of this thigh is facing up as best you can.
So about like
That's
that.
right, we'll get someone to feed you grapes. There you are, lie back.
Good.
Just get yourself comfy. You'll be there for about 10-15 minutes. Well, we won't. Good. Probably your legs. There we are. Is that okay? Oh, I'm sorry.
Well, I
Your,
know
your
that.
hip's a bit stiff, isn't it?
Yeah.
Good. We haven't. Okay, so I'm just going to put a little bit of local anaesthetic in. It just stings for a few seconds. So just coming up just now. So it just nips for a few seconds just to numb the skin. Okay. And I'm just going to pop a little plastic tube into the vein. You might feel it pushing, but it shouldn't be sore. Okay. Bit of pushing coming up now. And we can just see the centre of the tube there in the middle of the vein. And we know that's in. So that's one little plastic tube in. Good. And we'll just tape that in place so it doesn't fall out. And just a little bit more like that, really. So just the same as the other side. You know, very. Okay, so just a small scratch of local anaesthetic again, just stings for a few seconds. Bit nippy coming up now. So just a little bit of pushing, shouldn't be sore. Bit of pushing coming up now. And that's the little plastic tube in the vein again. Just follow the point in the middle of the vein. Right, that's the second one in. And again, a little bit of water just to stop the tube from blocking off. And we'll tape that in place. Good. So halfway there. If I can just get you to straighten your leg out a little bit. Is your hip all right?
Yes, it's
That's-
all right. A bit better there than it
That's
was
fine,
back
yeah, okay, great. If you just give me a little bit of warning if you want to move. Looking at the great saphenous vein just below the knee. So just a little bit of local anaesthetic. Small scratch coming up now, bit nippy. Okay, so I'm just going to pop a little plastic tube in this vein. It shouldn't be sore, you might just feel a little bit of pushing coming up now.
Didn't even feel that one.
Vein's quite thick down here, it's putting up a bit of a fight.
Mm-hmm.
Doesn't want me to do this to it. But that's us in nicely. Good. We haven't spilt a single blood cell yet, so
No,
it's very precious.
I'm very pleased about that.
a little bit of water to keep the tube open. And I think just one more down at the ankle here.
Right.
Sometimes it can be a bit nippy down here.
Can you? Oh, dear.
I'll just warn you. And the skin's quite thickened down here, so sometimes it needs a little bit more pushing. But we like to treat the vein right down to the ankle if we can,
Yeah.
especially in people who have had ulcers.
True.
Small scratch. Small scratch coming up now, bit nippy. So I think that's the sharp bit over.
Good.
We'll just tape that in place. And if you just lie still, we'll help you move in a moment, okay?
Mm.
Good. So we get your leg in the air to let the blood come out of your leg, shrink the veins down.
Feel secure?
Yeah.
Feel all right?
Fine, good. Okay, sir.
Yeah, fine.
So what we're going to do now is put the foam in, and as you know, you don't feel that, and we can watch the foam go into,
Go in there,
yeah, because it's got bubbles in it, it
Yeah.
shimmers, and we can see exactly where the foam's going.
Great stuff.
Make sure we know that the foam is filling the vein that we
Yeah.
want to treat and not going anywhere where we don't want it to go.
Good.
Okay.
Thank you. When this is being done, it is perfectly straightforward as far as I'm concerned. As I say, with the local anaesthetic anyway, there's no problem with it at all. There's no pain, no nothing. So I'm perfectly happy with the lot of it.
We're going to make the foam now, and what we're going to do is mix 2 millilitres of sterile air, which we've drawn up into this syringe through this filter, so it has no bugs in it. And we're going to mix it with 1/2 ml of the 3% fibrovane STS, which is the active sclerosant. And we're going to mix it through what we call this 3-way tap. And by oscillating the air and the sclerosant backwards and forwards, it will turn from a liquid into a foam. And then we'll inject that into Mr. Bowden. And that's the foam that gets injected.
Cool. So if you watch the
Are we
screen,
capturing?
so you'll see it's how light we're capturing.
About to come, isn't it?
There it is.
That's it.
There we go. There's
And the
foam.
vein goes into spasm, so that black, big thick black line turns into a fine white line, and that's the
And
vein
follow it
blocked
up.
off. And we put it in nice and slowly. How are you feeling, sir?
Fine. thank
Any?
you.
So if you tap your foot up and down for me, sir, nice ankle wiggling, straight up and down at the ankle. That's lovely. Keep going like that. Feel okay?
Is that moving, is it?
Yeah, that's fine. Just relax.
So we'll just put the foam in nice and slowly. Here it comes. The vein's gone into spasm nicely. You feeling all right, sir?
Fine, thank you.
Good. Do you feel anything at all?
No,
No.
not at all.
Very good.
It's your touch, you know, that's the thing.
If you could wiggle your ankle up and down.
Sir.
You had a bit more 3%. I think this vial's just about finished. So a little bit more foam going in. Here it comes. And so you can watch it, it's very controlled, you can watch the foam travel along the vein. It's quite pretty, isn't it?
Oh, very. Better in colour, really.
Yes, we should. Why? We should do it in 3D, really, shouldn't we?
Of course, yes. Need special glasses for that.
Yeah. And if you could just wiggle your ankle up and down again. There we go. Just travelling. And we can put it in nice and slowly so we can control it very accurately where the foam goes, which means it's a very safe technique. And we can also make sure that there's no foam in the deep system. So that's good. Because it's quite a big vein and he's got quite severe disease, we're going to retreat the vein further up the leg. Sort of a second hit, really. The first thing that happens when you put the foam in is because it's an irritant to the vein goes into spasm. So the little muscle fibres in the vein contract and make the vein shrink down. And that expels what little bit of blood is left in the vein. Because when the patient has their leg up in the air, the veins are pretty empty anyway. And then what it does is strip the non-stick lining off the inside of the vein and makes the vein wall sticky. So the vein walls stick together and the vein blocks off. And over a course of several months, it just turns into scar tissue, really. So that's how it works.
Okay, sir, all done. So if I could get you to give me your hand on that cotton wool there.
That one there?
Yeah.
Because you're on all these blood thinning medicines, you might get a little bit of bruising, but in fact, it's all, you know, we've not had any bleeding from your leg at all, really. Okay?
That's fine.
You feeling all right?
Fine, thank you.
Good. So now we've put the foam into the vein is blocked off. If we weren't to put compression on the leg when Mr. Bowden stood up, there would be a tendency for the vein to reopen, which is obviously not what we want to happen. So what we've done is put some padding over the vein and then a bandage to hold the vein closed, and then we're going to put a stocking over the top. And that just keeps the two walls of the vein close together, so it blocks off and scars up over the next few months. So this is a European Class 2 stocking, full-length stocking. Good.
Yes, sir.
If you just bend
your knee, sir. There we go.
That's it. So we've done it in a way that the knee and the ankle can bend, so obviously the patient can walk around relatively easily.
How's that?
Oh,
Right.
yeah.
How was
Your
that?
back back, and then you can swing your legs around when you're ready and pop your trousers back in.
Fair enough. Okay, yeah.
So how did you find that? Was that
Fine.
okay for you?
Oh, absolutely. No problem at all.
Okay, lovely. You all right?
Same instructions as last time, sir. Good walk around now for 15 minutes before you get back on the car to go home. After that, you walk for a minimum of 5 minutes every hour that you're awake. Bandages and stocking on for 5 days, during which time you can't bath or shower. 5 days will take you up to next Friday. So on Friday you can get yourself in the shower with the bandage and stocking on, allow it all to get wet. Then take yourself back to your bed with your leg out flat, take the wet stocking off, cut the bandages off, take all the padding off, pat your leg dry with a towel and put your clean dry stocking back on.
Good.
Wear that day and night for another week, and then weeks 3 and 4 just wear it during the day whilst you're up and about. But you can take it off at night if you want to.
Well,
After that, because you've had the ulcers, we'll get you to go back into the short stockings. This is a summary of all the instructions, my contact details, and I'll see you back in clinic on the 22nd of May in the outpatients clinic at Solihull Hospital, and there's your appointment letter. So I'll tuck all this lot in the box with your spare stocking. Go down over here and I'll get
Yeah,
you
just take it steady. That's fine. You're right.
That's it. It was all right, I think.